Oke, mohon untuk panitia untuk membantu dan mengarahkan kepada seluruh peserta. Ya. Bagaimana panitia? Apakah acara bisa kita mulai? Baik, selamat siang dan salam sejahtera untuk kita semua. Yang terhormat Dekan Fakultas Teknik Ilmu Komputer Jakarta Global University beserta dengan seluruh ketua jurusan dari Fakultas Teknik, ya. Lalu yang kami hormati Program Manajer acara JITEX 2021, Bapak Ongki.
Oke, terima kasih kepada Bapak Age. Okay, thank you for Mr. Age, who is currently now in JGU Auditorium. So, ladies and gentlemen, today we will have a very interesting webinar. And here with us already joined 36 online participants and 50 offline participants at Jakarta Global University Auditorium. But before we start our webinar today, let me read the rules.
Tapi cuma hari.
Okay. First, for all the online participants, please mute the microphone during speaker's presentation to ensure the event runs smoothly. And second, for online participants, please turn on your camera so we can have more engagement. And for offline participants, please give your attention to the screen at the auditorium. Okay, we will start our webinar shortly. Assalamualaikum warahmatullahi wabarakatuh, and very good afternoon for everyone. With the topic Internet of Things for COVID-19 pandemic. This webinar aiming to give information and knowledge about IoT or Internet of Things in help during the COVID-19 pandemic. So in hope, after joining this webinar, all the participants will get more knowledge and interest in IT, especially in Internet of Things field. And for your information, this webinar is organized by Jakarta Global University, also as a part of JITEX 2021. And before we start our session today, let me introduce myself first. I'm Nurul Islamiah S.Tr.Kom. As your moderator today, I am also a lecturer at Jakarta Global University. And here with us already joined our speaker, Associate Professor Dr. Mohammed and Abdulrazaq from Management and Science University, Malaysia. He is currently an Associate Professor at Department of Engineering and Technology, Management and Science University, Malaysia. His contribution to his research field is evidenced by his publication, mainly in Internet of Things or IoT, robotics, metal processing, and advanced materials joining. And he has more than 850 citations and also has authored or co-authored more than 130 publications, including patents, books, chapters review, and peer reviews papers in journals, also conferences. He is also working on project for the COVID-19 pandemic and won in several international competitions like Republic of Croatia International Award of Merit for International Innovations Awards 2021, Malaysia Technology Expo 2021, Silver Award of International Innovation Awards for Innovation of Recent Advances and Perspectives of the COVID-19 Detection and Diagnosis System using IoT-based technology in Malaysia Technology Expo 2021, Gold Medal in Innovation Novel COVID-19 Detection and Diagnosis System using IoT-based technology in ITEX 2020. So that's the profile for our speaker today. And I am sure that you cannot wait to hear, also watch the presentations. But before we start our webinar today, I will read the agenda for today's event. First is opening. Second is presentation from our speaker. Next, question and answer. So you can type your question on the chat box. And then continue to photo session, also closing. Okay. And for now, it's time for the presentation from our speaker, Associate Professor Dr. Mohammed. Please, to Prof, time is yours.
Okay, thank you very much, Ms. Nurul Islamiah. Assalamu alaikum wa rahmatullahi wa barakatuh, and very good morning, or I don't know, in Jakarta, still afternoon. Okay, so this is Associate Professor Dr. Mohammed and Abdulrazaq. Nurul, can just let me please share the sound?
Excuse me, Prof?
Yeah, share the sound. Yeah, share the sound because I just want to.
What sound, Prof?
So just a minute. Can you hear?
Okay. Actually, the screen already open.
Okay.
This is Associate Professor Dr. Mohammed and Abdulrazaq from Management and Science. Today I'm going to talk about the Internet of Medical Things based on wearable technology. And we will go in some challenges and the impact of the healthcare systems. And also, we are going to go in a bit further step about how can the Internet of Medical Things or the Internet of Things can be implemented to fight against COVID-19 pandemic. Okay, so now at the beginning, what's the meaning of the Internet of Things, or what we call it is IoT? Internet of Things rise as a powerful domain where embedded devices and sensors can connect together and exchange the information over the internet. Okay, IoT explore new dimension of patient care through real-time health monitoring and access to patients' health data. This data is a goldmine for healthcare stockholders to improve patients' health and experience while making revenue opportunities and improving their healthcare operations. Okay. Now, when we go to the about the possibility and where this can be embedded. So now, for example, we can have wearable technology can be fitted into the device connected to the to monitor
Cuman suaranya kagak ada.
local pressure and so on. There's many applications can go through. Okay. In addition, the IoT in healthcare can be used continuously to check the various health conditions, and this made taking care of the elder people better. So no need to check the one by one, put one person to check. So we can just put a device and we can follow up with that elder people or the patient. This technology have greatly benefit to the people who live alone or that are away from their families. Okay, in case of any changes or detection in the routine, definitely we can get like alarm system will give a notification to the phone or the device we are using. Okay, so now, for example, when I go to the what's the benefit in IoT in healthcare? Number one is the patient accessibility. Okay, it will be like a flexible, portable. Okay, electronic medical record, reduction of the cost and time. Besides that, when we go to the self-management treatment, okay, personalization, friend user interface, and interaction. Besides that, we can go for the remote monitoring device. We can continuously keep monitoring and early detection and improve of the quality of life. Okay. Now, when we go for the step forward, how the Internet of Things, how the Internet of Things can, or the IoT technology can fight against COVID-19 pandemic. Okay, so now, for example, as we know, the most recent the outbreak, the COVID-19 pandemic is discovered in China and in December 2019, but until now, it's keep moving on. Okay, until now, where all the world is suffering from this, but now we'll divide for the IoT system can be go into the three sessions, okay, or three subsections. Okay, for number one, we're going to go for the symptoms detections. Okay, for the symptoms detection, as we know, for at the beginning when they start when the COVID-19 is just appeared, they use the infrared gun, and many people were checking, and they are infected, and the transfer from the person or from the suspected to the persons. Okay, or the health officer then is going to have infected, and many people suffering from this situation. So in this issue, for example, we have two devices can solve this kind of thing. Number one is the smart helmet, okay, and the smart drone. Okay, what's the principles of those two devices? Okay, number one, we have a thermal camera, and number two, we have optical camera. Thermal camera can do like a scanning, okay, and it can detect the high temperature straight away. Another camera can focus, okay, on take a screenshot to the suspected person and give the data. And this is how is the principle. We have like a GPS device, okay, to track the what call it the location, and we have this is the components like a camera over there and a microcontroller and Wi-Fi module. How can we transfer the data? Okay, And beside that, okay, now when we talk about the drone, it can be implemented in the inside or also outside. Okay, but when we talk about the bigger area, we can talk about the drone. So the drone can do scanning, the same principles, and can do scanning. After that, it can give the details about the information about what's going on the ground. Okay. Beside that, we have the Google location history, so we can track once we detect that based on his movement, we can get the history. Okay, so it's very easy to track the people who's a close contact with them. Okay, this is a picture. Okay, we can just detect the picture over there, and this is the application of the Google location history and how it's going to be. Okay, so now, for example, when I say why I want to use this kind of things, okay, number one is less human interaction. Okay, so and beside that, when we say less human interaction, that means is be far away from the people when they're doing the checking. Also, we can reduce the hazard or the possibilities to get infected. And beside that, we can say the less time consuming because can go and cover a very large area. Okay, so we can reduce the time. Beside that, also we can get the reliable data to get the info about the persons when we do the scanning. Okay, when we can implement this kind of thing, we can build it, in government agency, in education, public places like a shopping mall, and the public transportation, like airports, bus stations, and so on. Okay. One for the next step when we go for the COVID-19 for the disinfection process, and how can IoT can help to reduce the danger of this kind of virus. As we know, the COVID is mainly transmitted by aerosol and droplets, which come from the infected where sneezing or coughing. This droplet can be survive on the surface or can on the air, especially now in the Delta variant. This can move some on air. Okay, so it can be touching the surface and can survive there for a long time. Okay, so what we can do, the disinfection system will give ability to provide a safe and disinfected area. How can we eliminate the virus from the surface? Generally, we will have four types of devices connected in through the Internet of Things and can manage how can help actually to clean up the surface. Okay, number one is the spray disinfection drone. The second one is a fogging disinfection drone. Another one is spray disinfection robot. And last one is hand sanitizer disinfection robot. So when we go, for example, for the spraying disinfectant drone, it's like a drone. We implemented the same drone like an agriculture drone, but we will give a camera there with a speaker there, and we put the chemical inside. We usually for the big area use a bleach. So this is, as we know, this is a bit harmful to the human body. So what we can do monitoring, and we can see if there is nobody there, we can start the process. And if there is somebody there, we can communicate with them, okay, through the speakers attached there, and we can give a warning and notification to move from that area to start with this infection process. Okay. At the same time, when we go for the fogging process, it's the same. Also, usually they use it in the agriculture process, but also can be used in these things. But this one actually cannot be used in the closed area. Usually this can do in very open area. As you know, this is a smoke and would be harm to the lung, and this is a big challenge. Okay, we have to definitely, there is nothing perfect. We have to, if we want to get something, we have to sacrifice something else. So the best implementation, we can use it in the open area. Okay, when we move on, another process, we have a spray disinfection robot. This robot actually, we can send the robot in the closed area, and maybe this is infected area. So we are scared to go over there, and we can just send the robot and can move on and can just spray the chemicals, okay, and after that we can send as a human. This is can actually reduce the close contact with the contaminated area. Okay, and one more things, we have also sanitizer, hand sanitizer. If we can see it here, this is like a robot. Okay, so it can be move on, and as we can see it here, it can move here and there. And so whenever is we have ultrasonic sensors, whenever we just put the hand close to it, then we can just dispense the chemical over there. In this case, we can do it no need to have any touching the surface, because maybe the person before us is infected and touch. Okay, this is straight away once touching the what call it, the ultrasonic sensor. Okay, so now we'll go for the last one. When we go about the breathe aid device to assess the COVID-19 patient, infected patient, as we know, the pandemic, okay, straight away the most people suffering while they are infected by COVID-19. They are infected their lungs, and they are suffocated and have some lack of oxygen and have some issues with the breathing. So many of people, they are dying because of this. Maybe cannot get the suitable or the immediate oxygen supplier or ventilator. So in this case, what we can say, you can see it here, some work like go with the oxygen concentrator, can just get the oxygen from the normal atmosphere and just purify and concentrate and can give it to the patient. Okay, besides that, we can have it this one in the mobile phone application, and we can see what is the details. Besides that, we have oximeter. We can check the patients if you need oxygen or not. Okay, when beside that also we have another type. We have a portable ventilator. Okay, this is also the mechanical ventilator. Okay, just squeeze like a balloon inside and can just press the air and to go inside. Definitely, we try to simulate how is the movement of the lung. Okay, because it's not a stream of air can go inside the patient lung. Okay, and we have to simulate that what is the rate of the breathing. Okay, and we have like a alarm and also some system if the patient, because we have oximeter, it can attach to the patient hand, and we can read the oxygen level. If it's reduced, okay, can give alarm, and if it's already in good condition, we can stop the ventilator. Okay. So this is in generally the devices and can use it. How can IoT really support to finish or to stand against COVID-19? Okay, now as we can see that precise and fast diagnosis for COVID-19 is really needed. And beside that, also the smart disinfection with fast and large area is also really needed, because we need to avoid any close contact with that contaminated area. And beside that, for the breathing process is really needed. The breathing process, the breathing devices, we can be use it into the clinic or even some home use, until as we can see now in the many hospitals overloaded and there is no places for the patient. Okay, so I hope those things can help, okay, our community to stand against COVID and to improve the healthcare system. For further inquiry, you can contact me. This is my phone number and this is my email, Associate Professor Dr. Mohammed and Abdulrazaq from Faculty of Information Science and Engineering from Management and Science University. Thank you very much, and I wish you to stay in good health and good condition. Assalamu alaikum.
Okay, so I hope is it clear?
Okay.
Any question? Most welcome.
Yeah. Okay. Sorry. So my camera. There's some issue with my camera. Okay. Thank you so much to Professor Dr. Mohammed for a very nice presentation. Next, we come to next session, which is the question and answer. So here on the chat box, already from Afrisal Robiades, the question is how to make sure the virus is die after the disinfection. Can you help to explain the effects of the virus after exposure to the disinfectant? Thank you.
Okay, well, based on the research conducted, the bleach is can kill the virus, but when we talk about the accurate results, when we sanitize or disinfect, how many percentage of the virus will be died is nothing accurate yet. Actually, there is no exact data can show how much the percentage of the virus can be dead. But based on the current research, when we said the bleach once spray the virus, once it's reached the virus, that means the virus will be killed. Okay, confirmed about this. Okay, so this is that's why many tests have been done, like especially when we go about the wide area, they use the bleach. Okay, because bleach cannot use it inside home, definitely, because as you know, it's a chlor. So, and the chlor is very harmful to the human body. Okay, so that's why we use alcohol instead of a bleach. But when we talk outside, okay, bleach number one is cheaper, number two is more effective. But inside for the hand sanitizer, usually not advisable to use a bleach because this is a chlor and it will be very harmful to your face or touching your face or to your hand. Even though we are using very low concentrated percentage, okay, is less than 0.1% or 1%. Okay, I hope I answered the question.
Okay, thank you so much for Professor for the answers. Again, I would like to say sorry because there's some issue with my camera, so I cannot turn on my camera. Next, another question. As explained, IoT is indeed very useful for human life because it can provide various information only through an internet connection. But with the ease of getting this information, can IoT be considered safe?
In terms of, because actually I didn't get the question exactly. Just a minute, just let me read it from the slide. A human life, because it can be provided through the internet, but easy information, how can considered safe? Okay, in terms of, I don't know, I did not really get the question about the
maybe safety from like the internet itself because it's connected using the system.
Okay.
Maybe, yeah.
Okay, so in this case, when we talk about definitely about the security, there is now many research try to improve the security of the privacy. What I can say about the privacy, because as you know, anything is connected to the sorry, anything connected to internet can be hacked. Okay, definitely, like the computer, like your phone, like even nowadays the car. Okay, even the car, the new models, as it's connected, it can be hacked, can stop the car in the middle, honestly. So definitely there is now a lot of improvement on this part, because as we know, there is nothing perfect in this life. There's advantages and disadvantages. Okay, in terms of security, definitely need to improve more. Okay, when we talk more, improve more about what? Improve how to secure the database from the patients or from the of the user itself. But as of now, it can meet the requirement. Okay, and there's many research actually move on to develop this particular area.
Okay, thank you so much, Prof, for the explanation, also the answer. Okay, another question? Maybe? Okay, Prof. So here with us in auditorium of JGU, there is a JITEX exhibition, and with the participants offline there. Okay, no questions? All right. If there's no question, maybe we can close. Oh, okay. There's one question. What is the advantage of IoT in developed tools? Why we need to implement IoT? What is the potential thing for the IoT itself?
Okay. As I just explained it now in the beginning of the presentation, when we use IoT, at the beginning, IoT can be now in everywhere in our life. Can be in health sector, can be in engineering parts like mechanical engineering, chemical engineering, civil engineering, can be in education. Okay, so all those things can be considered in parts of the Internet of Things. Why I want to use Internet of Things? I can simplify the life. I can simplify the life. I can, for example, I can control my home. Okay, I'm living in KL, I'm working Sha'ala. Okay, this is in Malaysia. So around 30 kilometers away from my home. But I can control my home using my phone from far. I can on light, off the aircon, on the aircon. I can monitor the camera, the security, I can check what's going on in my house, outside my house. Okay, all those things is part of IoT. When we go to the healthcare, I can manage. Okay, as some friends here, my colleague, they're doing some research about the Parkinson diseases. Okay, so it's using IoT. It's going to help a lot of patients. So no need to go to the hospital and go to the doctor, and we have a device and we can monitor the patient and we can assess the patient. Okay, so it will be more easy, and we can have a database and statistical data, and we can see if there is any improvement, or I can see is some getting down the situation. Besides that, the one doctor can monitor 100 patients. You are not going to see a doctor face to face. Not going to see the doctor face to face. When you see face to face, that means one doctor, one patient. Okay, when you use IoT, can use one doctor, 100 patients. Can monitor all of them, can check, can see what's their status from far. So those things make our life is much more easy, actually.
All right, thank you so much, Prof, for the answers. Okay, maybe this one is the last one, the last questions. Can IoT be implemented in a real hospital since nowadays COVID-19 pandemic itself become worse?
Yes, definitely is already there. Already there. If you see the robotics can move on inside the hospitals, can collect the biological waste, they can collect the mask. Now we have some project now currently working with the robots, can collect the mask from the ground, and when it's moved, do sanitizing and disinfect the ground as it's moving over there, and to reduce the human interaction. And besides that, you can see the robots, they can send the food and the meal to the patients. Okay, can moving over there in the real situation. It's not prototype only, no, it's already implemented in the hospitals. Okay, and you can see that the robot can checking the temperature and do disinfection part. And beside that, also we can see the ventilator is already connected to the phone, and you can monitor the patient. So it's already implemented, actually. It's already there.
Okay, that's all for the answers and also the questions. Thank you so much for Associate Professor Dr. Mohammed. And very interesting presentation, and also topic about IoT in help for the COVID-19 pandemic. As we know, COVID-19 still there in our life since 2019, and what we do as an engineer, we can create IoT for COVID-19 to help our society in order to cure and also to maintain everything that can help to control the pandemic itself. All right, so we're already at the end of our webinar session today. And the next, I would like to ask all the participants here to open all the cameras. So we have the photo session. Maybe all the participants can turn on the camera. Okay. Ready? 1, 2, 3, smile. All right, please wait a minute. Okay, 1, 2, 3, smile. All right. Okay. That's all for the webinar today. I would like to say a lot of thanks to our speaker today, Associate Professor Dr. Mohammed and Abdulrazaq from Management and Science University, Malaysia, for a very nice presentation about IoT. Is there something you would like to say to all the participants here, Prof?
Okay, thank you very much, Nurul, for very interesting and very amazing events. Actually, I'm so proud of the achievements of the JGU. Was again what I can see there. They're moving very fast. I really like the strategy and the situation there in JGU, and definitely, inshallah, we hope to meet physically, inshallah, again in JGU one more time, inshallah. And I just would like to all my friends and all the students there, when we talk about the COVID-19 is not the task of the frontliners, not the task only for the doctors. Okay, this is, we are sharing the same land, we are sharing the same community. Okay, so each of us, we have to put effort to fight against this COVID. We are, as a scientist, all of us, we have to move on. We have to contribute to stop this pandemic, to back again to our life. Okay, from this point, I wish everyone to stay safe and stay healthy and keep all beloved one safe and healthy. And I hope to see all of you, inshallah, physically. That's all from me. Thank you very much again for this great opportunity. Assalamu alaikum wa rahmatullahi wa barakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you so much for Dr. Mohammed and all the participants who already joined in today's webinar, online and offline. Now, go back to Mr. Age in JGU Auditorium. Mr. Age, can you hear me? Okay. Okay. So I think that's all for today's webinar. Before I give it back to Mr. Age, I would like to close this webinar. I would like to say thanks to all the participants, to our speaker for the joining us today in our webinar today. Okay, thank you so much. Maybe we can close this webinar today. Thank you all. Thank you, Prof.